I'm Kevin Keenahan, founder and CEO of Tissue Analytics, and today we're here in Spark. We had a really interesting experience founding the company. Me and Josh, my CTO and co-founder, we both come from the Johns Hopkins Center for Bioengineering Innovation and Design, which is an extremely cool program at Hopkins where biomedical engineers can actually go out and rotate through different clinical settings. So, as a master's student, I got to see cardiothoracic, surgical oncology. We got to go out and actually spend time with clinicians, at Hopkins Hospital. That was actually where Josh and I first met our third co-founder, who was doing his residency in general surgery at the time. Dr. Gabriel Brott is really an expert in wound care, and it was there where we first got the experience of how wound care is treated in the US and started to think about how wound care could be changed, could be improved. Tissue Analytics has the potential to fundamentally transform how wound care is done in the United States. If anyone's not familiar with wound care, we're typically talking about things like bed sores, diabetic ulcers, venous ulcers. They're these nasty chronic conditions that can really take months and sometimes years to heal. Actually, from a study that we did right around the corner here at Hopkins, we found the average wound duration that the patient has is 23 months. So if you can imagine that living with an open sore on your body, on your backside, on your feet for 2 years, it's crazy. Part of the reason the wounds take so long to heal is there is not enough doctors who specialize in wound care. And patients are predominantly cared for in one of these, kind of post-acute markets like skilled nursing facilities, nursing homes, home care groups, and it's hard for them to get in to see a specialist. Our technology essentially connects the expert physicians, the expert nurses, the expert doctors with those patients who are being cared for in skilled nursing facilities. There's a really critically important aspect of the system that enables the non-specialists in the field to collect data, and that's how we use machine learning and computer vision to provide much better data to clinicians so that they can see for really the first time how wounds are actually progressing. If a wound is healing at an appropriate rate, if it's deteriorating, if it's stagnant, which products are working, how frequently they actually need to see the patient. All of these things are really changes to the care that can result from kind of the platform that we provide. A big piece of the system is combining medical imaging and machine learning. We are very much an artificial intelligence company. We use this machine learning technology to essentially provide clinicians with extremely high quality data around how wounds are progressing. Our technology, in a nutshell, can look at a photograph of a wound and automatically extract the size, changes of the wound, and sort of how all the relevant characteristics are changing. We present this data in a way that makes it very easy for clinicians to identify the progression of the wound. But I think the really important thing to note here is today, clinicians, the only real way they have to track how wounds are healing is with a ruler. A centimeter ruler, they measure the length, they measure the width. It's extremely difficult for them to get reliable data out of wounds, and artificial intelligence, computer vision, is a great way to get that data to clinicians.